In this video, I'm going to talk about Raynauds. We will look at what the condition is, what the symptoms are, what causes it, how it's diagnosed and how we treat it. I'm Stephen Bunting. I'm an MSK physiotherapist and sonographer based in the UK. Welcome to the channel where we explore the common MSK problems that normal everyday people experience and the evidence-based treatments that can help. Raynaud syndrome is a vascular problem. It's categorised as an episodic vasospasm. Episodic just means that the symptoms occur intermittently rather than all the time, and vasospasm is where the blood vessels become narrow and constricted, which restricts blood flow. In Raynauds, it's the blood flow to the hands and fingers that's most commonly affected. We don't know why some people get it, but it does tend to run in families, which suggests a possible genetic cause. And while I said that Raynauds is a vascular problem, strictly speaking, it's actually a neurological problem, because the diameter of the blood vessels is controlled by nerves, called sympathetic nerves. The sympathetic nervous system controls various automatic or involuntary body systems, such as your heart rate, the diameter of the pupils in your eyes, your skin, such as goosebumps and the control of sweat glands. But these nerves can also control the diameter of the small blood vessels all around the body. They do this by controlling the activity of tiny muscles that wrap around the blood vessels. And when these muscles activate, they essentially squeeze the vessels, narrowing them and reducing the blood flow. This is a process called vasoconstriction, and it's a perfectly normal and useful process, particularly when the body is trying to conserve central body heat or to raise blood pressure when necessary. But in Raynauds, vasoconstriction occurs for no good reason. It's almost like the sympathetic nerves have become overly sensitive. They activate far too easily and reduce blood flow, particularly to the hands, when it's just not needed. Anyone can get Raynauds, and it can start at any age, but it is most common between the ages of 15 and 30. It affects about 5% of the general population. That's 17 million people in the US. It's more common in women by about 5 to 1. It's also more commonly seen in colder countries, or in people who already have poor circulation, such as smokers, diabetics, and people with peripheral vascular disease. Now, what I've described so far is primary Raynauds, which starts for no obvious reason and accounts for nearly 90% of people with the condition. But there is another type of Raynauds called secondary Raynauds disease, which is less common and is associated with other conditions, typically some of the autoimmune diseases such as lupus and scleroderma. The first symptoms that people tend to notice are painful fingers when exposed to cold temperatures, and it can be triggered by simply reaching into the fridge or freezer, or if the air conditioning is suddenly turned on, or even just holding a cold drink. Raynaud symptoms tend to occur intermittently in a Raynaud's attack, which is often triggered by these sudden changes in temperature, although stress and anxiety have also been found to trigger Raynaud's attacks. The symptoms are cold, numb, painful fingers, which classically change colour, first turning white as the blood vessels constrict, then blue as the oxygen in the fingers depletes, and then red as the attack ends and the blood flushes back to the fingers, often causing a tingling sensation and stinging pains. All three colour changes don't have to occur with a Raynaud's attack, but the white blanching colour will always tend to happen. After that, you might get the blue or red colours, but not always. While the symptoms most commonly affect the fingers, they can also affect other vascular beds, such as the feet and toes, the lips, ears, tip of the nose, and the nipples. In more severe cases, or if the problem goes untreated for a long time, the skin can start to break down, causing sores, ulcers, blisters, and rashes. Raynauds is usually diagnosed clinically, meaning that a clinician will listen to your symptoms, Examine your hands and sometimes your feet, and then make the diagnosis based on that information. Blood tests are often used to exclude other causes and to test for some of the autoimmune diseases associated with secondary Raynaud's disease. Occasionally there might be a need to confirm the diagnosis, and that's done by using a test called nail fold capillaroscopy. The skin at the base of the nails is examined using a small camera or microscope. In Raynauds, the tiny capillaries have a distinctive appearance. During an attack, it's best to keep your fingers moving to help restore circulation. You could also try massaging your hands or feet. If you're outside, then putting your hands into your armpits can warm them up nicely. If you're inside, then you can warm them up slowly using warm water. Don't use water that's too hot though, as this can be painful. Look how the colour of the fingers returns in this person with Raynauds as they apply warm water to each individual finger. This is a really good example of finger colour dramatically returning after a Raynauds attack, and thanks very much to this Instagram user for allowing me to use it. To stop a Raynauds attack in the first place, the most helpful preventative measure is the obvious one. Just keep your hands warm in colder weather and avoid exposing your hands or feet to sudden changes in temperature. So of course, using warm socks and gloves is going to be important. Gloves using silver thread have been found to be particularly helpful in Raynauds. You can also buy rechargeable electrically heated gloves, which are good for a few hours, and also hand warming power packs. When outside on cold days, the warmest item that you can use for your hands are mitts, which are generally much warmer than gloves, but of course they do reduce your finger dexterity while wearing them. I'll put some links in the description to all these products and anything else that I find might be helpful in the future. If you're a smoker, then stopping will be the best thing you can do to help with symptoms and improve your circulation. And similarly, if you're a diabetic, then optimizing your control should be your main goal. There is some evidence to support the use of supplements in Raynauds. Fish oils and ginkgo biloba are the most commonly used, but also vitamin D, particularly if your blood tests have found that your vitamin D levels are low. There is an opinion that vitamin E, magnesium, niacin and evening primrose oil can also help, amongst many other more obscure supplements, but they aren't supported by the current research. If these simple things don't work in your case, then you're going to need to see a healthcare professional, as the next treatments will usually involve drugs which have a vasodilation effect. These work by acting on those sympathetic nerves which control the diameter of the blood vessels, and they can increase the blood flow to your hands and feet. There are a number of different drugs used for this purpose, but the calcium channel blockers are the main category, and a drug called nifedipine is the most effective of these. If you're still struggling with symptoms after all we've discussed so far, then you might need to see a rheumatologist, who are the specialist doctors who treat Raynaud's symptoms that don't respond to the usual treatments. And they might try some of the other specialty drugs available, such as the prostanoids, which are usually intravenously delivered, or the PDE5 inhibitors, among which is Viagra. After that, in severe cases, there are Botox injections into the hands or feet, and there is a surgical treatment called sympathectomy, where the surgeon removes some of those sympathetic nerves that control the constriction of the blood vessels. Okay, well that about wraps things up. If you've made it this far and found the video helpful, then please do share it with anyone else who might be interested, and don't forget to like and subscribe, as this really does help get the information in front of more people who might also benefit. So until the next time, thanks very much for watching, take care, and bye for now.